Dentists ask me, Janet, I know dentistry's walking out the door, and I need your help. I need for you to help me learn to sell dentistry. As a matter of fact, can you teach my team to sell dentistry? The team says, Janet, I'm not selling dentistry. I'm not a salesperson. I am a healthcare provider, a clinician. I went to school to learn to help my patients. I don't want to come across like a used car salesman. Selling dentistry so it doesn't feel like you're selling dentistry. It's a dilemma. But as my mother used to say, there's always two sides to every story. And then somewhere in the middle is the truth. And the truth is there's nothing inherently good or bad about selling. As a matter of fact, the truth is we all sell every day, all of us. From the young woman who gets a new job with an older employer who's trying to convince him that social media is really a viable and valuable marketing tool, to the father who's trying to convince his son, if you do your homework and make good grades, you may get a trip to Disney World, to the wife trying to convince her husband to paint the living room a new fashion color. We're always using our skills of persuasion and convincing to sell, if you will. So the question is not, do we sell, but how good are we at it, okay? And that's what I spent the first part of my career learning how to do, to improve my communication skills with my patients. My name is Janet Hagerman. I graduated from the Medical College of Georgia and practiced clinical dental hygiene for well over 20 years, honing my skills before I became a coach and a consultant. I then had the opportunity to work as the director of hygiene for a very large group practice overseeing more than 100 dental offices. So I had the opportunity to share with hundreds of health professionals just like you the communication skills that I had learned by trial and error. So today, I want to share some of those skills with you. Because the truth is, selling dentistry is something we all need to learn how to do. And selling dentistry is not anathema to good dentistry. Dental practice is a business, and if we don't make money, we're not profitable, we can't succeed. So the question becomes, how do we take good business skills, good selling skills, and marry them, if you will, with the very best clinical practices? So we're going to talk about that today. How do we do that? Because you know what? The truth is, we all like to buy. We just hate to be sold. So how do we take these practices and put them into good use and implement them easily? That's what I want to talk to you about today. Perhaps share some things with you that might be surprising. For example, why patient education doesn't work. All right? And if that doesn't work, what does work? I want to share with you my discovery process, how to discover your patient's values, and do it in a way that's quickly because, after all, what is the one thing we have the least of in dentistry? And that's time, okay? Share with you the discovery process, how to discover your patient's values, because every patient is different. So you can't use the same case presentation on one person as you do on another. You could be sharing, one person could need a crown, that same crown could be needed for 2 other patients, but you're not going to present that the same way each time. So the discovery process teaches you how to learn your patient's values and then customize your treatment plan to that particular patient's values. So we're going to talk about the discovery process. We're going to talk about the treatment triad, which I've been told can triple case acceptance. How do I know that? Because doctors have shared that with me and their teams have shared that with me that have tried it. The treatment triad gives you an easy way to present treatment to a patient in a very comprehensive manner. In a comprehensive manner so your patients aren't overwhelmed, as in, how come my last dentist didn't tell me I needed all that treatment? All right? Go from overwhelmed to appreciation, as in, wow, that's the most thorough exam I think I've ever had. How do we do that? The treatment triad is going to show you how to do that. Easy and fun. And finally, I want to talk to you about a little what I call transformational vocabulary. It's the power of the spoken word. And you've all heard about the power of the spoken word. Many very famous people in history have talked about the power of the spoken word. One word can make or break your sale. It can make or break your treatment presentation and whether your patients enroll in that or not. One word. So we're going to talk about, writers know this. There are whole books written on this thesaurus, changing words for better meaning. So we're going to talk about words that can have a very powerful impact on your message, whatever that may be, and words that are what we call diminishers, that diminish the meaning of your message. So we'll talk about good words and help you come up with your own words to give your messages the best meaning. So at the end of today, you're going to be able to increase your case acceptance, sales, which will increase your production, profitability, all by increasing your patient care. So selling dentistry so it doesn't feel like you're selling dentistry. Today you're going to learn how to take these concepts and present them in a very elegant, comfortable, non-intimidating manner that's going to deliver and create value for your patients and make you feel great about what you have to offer. Oh, and by the way, create profitability. Thank you, and we'll get started soon. Thank you. Thank you.